I'm Dr. Mike DiTolla, and I'd like to share with you my favorite way to adjust and seat a crown, and that's the restorative strip system from ContactEZ. You know, the way I was taught to adjust crowns in dental school prior to cementation was to do it out of the mouth. And so we'd often try to mark the contact in the mouth some way and then take it out of the mouth with a handpiece and a burr and adjust that contact. And the scary part about doing that is that it's very easy to adjust that contact, put the crown back in the mouth, check it with floss, and you've got the gut-sinking feeling of that open contact, and now it's got to go back to the lab. That is a true defeat. And so when I was introduced to the restorative strip system, the great concept about this is that all the proximal adjustments are actually down in the mouth where you can't open the contact. So it's a great way to be able to seat the crown in the mouth, put the strip in, make any adjustments that need to be done inside the mouth with the strip system itself. Then cement the crown, and there's a strip to be able to help you remove any excess cement. And then finally a polished strip to be able to go in and smooth that contact and make sure that you've got that nice physiologic relief between the crown and the adjacent tooth that's possible. So when I decided to teach my dental assistant how to be able to adjust permanent crowns prior to cementation, it was with the restorative strip system because it gave me and her the confidence that she wasn't going to accidentally open contacts by adjusting them out of the mouth. And anytime you're holding a small restoration in your mouth and adjusting or polishing it, there's always a chance that it goes flying or you cut into your gloves or your finger. And so the genius of this system is being able to adjust those proximal contacts in the patient's mouth. So let's go ahead and take a closer look at the restorative strip system. The restorative strip system is based around Dr. Kim's concept of how to adjust and seat permanent crowns. And this is different from how I was taught in dental school, but I love seating crowns this way. It makes so much sense to me because we're adjusting them in the mouth against the two teeth where this crown is going to exist. In dental school, I was taught to adjust out of the mouth, try it back in again, adjust out of the mouth. And not only was it easy to accidentally open the contact by removing too much, but you were fundamentally changing the shape of the contact as well. And by doing this in the mouth with the flexible strips, you'll see that we aren't going to change the shape of the contact, and we're just removing a layer of glaze on the outside of the crown where our contact is too tight. So there's 3 steps to the restorative strip system. There's the adjustment phase, and we're going to do that with the black diamond strip. And then the cleaning phase, and that's once it's been cemented. We're going to use the white strip to go in and make sure we get out any excess cement that's around there. And then the final step is the polish with the gray final polisher. It's an ultra-fine diamond. And so we work our way from top to bottom. So 3 strips with this system. So the first thing we're going to do is take the crown and put it into the patient's mouth and try to put it down into place. And as I put it down, I notice it's pretty tight. And of course, the crown was actually made for us with too much contact to kind of illustrate this. And so we're going to go in with an Explorer and see what we feel here. And as I go in on the distal, it's actually pretty tight there. There's not a lot of room between when I reach in and try to get between the crown and the tooth. It's a tight space. I can't even really rotate or roll that Explorer at all. And when I go to the mesial surface, now you can see the tip goes underneath it and I can rotate it back. So I'm completely under the crown here. So there's a lot more space. I can dance back and forth with the Explorer. There's a lot more space here on the mesial than there was on the distal where I could barely get underneath the crown. And that tells me that the distal contact is the one that's too tight. And so it can be difficult when you put in a crown and it won't seat all the way to determine which of the contacts is too tight. So I made a little drawing to kind of help illustrate that. So you can see we've got our prep here, the blue portion of the drawing, and then we've got our red crown here. And I've already told you that the distal surface is the one that's overbuilt. So as you try to seat this crown and let it settle vertically onto the prep, because the distal contact is too tight, it pushes the crown this way towards the mesial. And as it pushes the crown to the mesial, you can see that we get a tight fit here on the distal. So when my Explorer went in, I could barely feel any space here. Even though the crown wasn't seating, that I wasn't checking to see if the margin was closed. I was up checking to see how much space was between the crown and the prep. And I could barely get in there. But when I came and checked over on the mesial, I could get my Explorer all the way underneath it. And so the fact that this was the mesial half was the half that was open, the more open between the crown and the prep, told me that it's the distal margin that's the one that is too tight. And so by using that Explorer test and understanding this concept, it lets you know where you should begin adjusting when it comes time to adjust the contacts. And so I'm going to start with the black diamond strip. It's single-sided. It's a fine diamond coating. You can see that it's shiny over on the other side. It's not serrated at all because there's no cement we're trying to cut through. All we're trying to do is make an adjustment to this crown, basically take some of the glaze off the distal where we know the contact's too tight. So we place it on the distal, and all we're going to do is go back and forth, buccolingual movements here, and work our way through there and take some of that glaze off. In the real world, in the mouth, my assistant would have her cotton pliers here right down in the middle of the tooth, holding that down so it didn't move at all. So we go back and forth 5 or 6 times. This one's pretty tight, seeing how much we need to go back and forth. And then we'll stop and we'll check and compare it to the mesial and see how it feels. And once it feels equal, where it feels like we can get into both of those equally with the same amount of pressure on both sides, we know that we're done. And keep in mind that the thickness of these strips is a little bit less than actually dental floss itself. So we know we're still going to get a pop. You know, we've measured a lot of dental flosses and they're about 65 microns thick until you take it and roll it around your fingers and you inadvertently twist the dental floss, and all of a sudden it increases the thickness where it's 85 or 90 microns thick. So you don't have to worry about potentially opening any contact if you're going in here and using these strips in between the teeth, because the strip itself is actually thinner than the dental floss that we use to check the contacts later. So we continue to work our way back and forth until we feel that both these contacts are equal, and then we know that we have finished it and we're ready to remove the crown and be able to cement it. And so when it comes to cementation, most dentists during the try-in phase will do the occlusal adjustment, but Dr. Kim is very adamant about never doing occlusal adjustment until you've cemented the crown. You know, part of the reason is this 90 microns of virtual die spacer or actual die spacer that's left there, and you never really know the exact final position of the crown until it's cemented into place. And so part of Dr. Kim's crown seating technique with the restorative strip system is to ensure that you don't do any occlusal reduction until you've actually cemented the crown. So once the crown is in place, we will use our Explorer to clean up any excess cement. And then we'll use the white serrated strips. So again, this has no grit on either side of it, just serrations on the top and bottom. And we can use this and go between the crown to clean out any excess interproximal cement that happens to be in there. And again, it's smooth-sided because we don't want to do any adjustment to the contacts that's already been done. So that allows you to get in and does a great job making sure we don't leave any retained cement there. And then we're going to go in with the gray strip, the ultra-fine diamond. Again, this one is single-sided. This one is not serrated because we're not using it to remove any cement. And this is what we're going to go in and actually polish, do the final polish on our contacts with the gray strip. And again, just back and forth 5 or 6 times. Because these strips are flexible, you can push this towards the distal as you do that. And so it wraps around that whole mesial surface of the crown itself. And now that the crown is cemented into place, this is when Dr. Kim does his occlusal adjustment, because there can be changes in the way the crown seats when you have 90 microns of die spacer. It's not a perfect intimate fit between the crown and the prep itself. So again, his concept is to do all your adjustments to the proximal contacts with the crown in the mouth next to the 2 teeth where it's going to be living for hopefully the next 20 or 30 years. Don't use rotary instruments. You know, use the strips to be able to adjust the contacts, clean the cement, and then polish the contacts. And never adjust the occlusion until the crown is permanently cemented so you know it's in its final position. I know that sounds like a hassle because now you have to do the polishing of the crown intraorally, but that's one of the reasons I love electric handpieces. With all that torque, I can get a great, nice high shine polish intraorally after the crown has been cemented. You probably know by now that I'm a big believer that your dental assistant should be adjusting your permanent crowns prior to cementation, if for no other reason it makes their temporary crowns that much better. And there's no better way to teach your dental assistant how to adjust permanent crowns than with the restorative strip system that you've seen demonstrated today. On behalf of myself and everyone here at ContacEZ, I want to thank you for your time and your continued commitment to quality dentistry.